So EoE is what we call a clinicopathologic condition, meaning that you have to take into account the clinical features like the symptoms and the endoscopy findings, as well as the esophageal biopsy findings. So the first diagnostic tool is actually putting the entire clinical picture together. And so making sure patients do have the right kind of symptoms and also do have the right kind of biopsy findings. Right now, all the standard diagnosis is done with endoscopy and biopsy. However, there are a number of other diagnostic modalities that are actively being studied that may have a good effect and be integrated into diagnostic algorithms in the future. Some of these are minimally invasive studies, so trying to avoid having to go through the endoscopy. There are a number of capsule-based mechanisms where patients might swallow a capsule attached to a string, and inside that capsule might either be another string which captures esophageal secretions, or a sponge that might capture esophageal cells. And this can be done without sedation and in the office-based setting. These are still in the relatively early research phases, getting tested to see the clinical utility and exactly how to interpret the results, but both have already had proof of principle shown. And so those are two very exciting diagnostic techniques. There are ultra-thin endoscopes that can be put in through the nose and go down to the stomach without having to be sedated for an entire endoscopic procedure, which could be used as well. Some people are developing some very novel imaging techniques using lasers or confocal microscopy that can be done in the esophagus that may help. And then there are some genetic tests as well that can be run on biopsies, hopefully with the goal of not necessarily having to worry about PPI trials and putting together clinical and histologic pictures, but perhaps giving a more definitive diagnosis based on gene differences and physiologic differences in the esophagus. So that's also has shown great proof of principle, and studies are underway to see the exact clinical utility of that as well. So I think a lot is going to be changing in the future to make the diagnosis process more accurate and more streamlined as well.